Today on an all-new Steve Harvey, she's facing her biggest fear.
My hands get so sweaty, my stomach hurts.
The dentist.
We have to tackle this fear. You don't have gas out here. Doc, don't mess around and get your little self knocked out. I'm here to help. You and I will get through this together.
Coming up next, childhood tooth troubles made her terrified of the dentist.
I get such bad anxiety, my hands sweat, I just get so nervous.
Steve's got a plan to help her face her biggest fear.
I had a little surprise for you. Well, folks, my next guest and I have something in common. We're both afraid of the dentist. That's true. I do not like the dentist. I've had some experiences there, never quite gotten over them. I don't care for it today. I only go to keep them looking decent. After that, I deal with it. But it works out. Check out this tape that my next guest sent in.
Hi, my name is Kelly Swanson. I'm almost 21, and I am terrified of the dentist. I started having this fear when I was 5, and I was waiting for my older sister to finish at the orthodontist, and so he looked at my mouth and just said, yikes. He realized I have huge teeth and a really tiny mouth. Since then, I've had 19 teeth pulled. Ever since, I get such bad anxiety, my hands sweat, I shake, I just get so nervous and try to tell my mom, no, I don't want to go to the dentist, it's so dumb, even though I know it's not. It's a crazy fear that I need to get over. So, Steve, I hope you are able to help me with this problem. Thank you.
Please welcome Kelly. Kelly, they think your teeth are too big?
They are. I have a little mouth.
No, see, we both got this big teeth thing just working for us.
I know, it's kind of like my trademark, you know. Everybody in my family knows I have the really small mouth, but the really big teeth.
How bad is this fear, though?
Oh my God. My stomach hurts, I get nauseous, I get dizzy, just sitting waiting. And it's because I've had teeth pulled, usually 4 at a time. I've had a total of 19 teeth pulled.
Wait a minute. I mean, you had 19 teeth pulled for what?
To make room in my mouth for all my teeth. Well, 4 of them were my wisdom teeth, but they couldn't fit in my mouth.
You didn't have room for them?
No.
Because I was finna say, your teeth look nice.
Thank you. I mean, they look nice now, but it was a lot of pain.
Wait a minute. You had to take out 19 of them?
I mean, even though I'd get put under for my surgeries to get usually 4 pulled at a time, I would wake up and I'd have so much blood. Like, I didn't know such a little kid could bleed so much from getting teeth pulled.
I really do get this fear of the dentist thing because I kid you not, I do not like going to the dentist at all. But I think that we have to tackle this fear. I think we got to find a way to do it. So I had a little surprise for you. Let's look over here. Now, let me just show you. Come here. Just come with me. Of course, you know nothing's going to...
Come over here.
Please welcome Dr. Brian Kantor. Doc, how you doing?
Good, how are you?
First of all, this is a good-looking dentist. So that'll help you out a lot. So this is the chair. We'll show you. I'm gonna get in the chair first. I've never seen a dentist chair like this, to be honest with you. This look like a camper.
First of all, what's a big husky guy like you scared of the dentist for?
What is a big husky man like you scared of the dentist for? Because I don't want my mouth open. I don't really like nobody's hand in my mouth.
I hear you.
Because you know what I don't like about y'all? You know, you see us gagging, and you continue to work like we didn't. You just saw me. Once I go, I think you should stop. But oh, no, you don't stop that, though, do you, Doc? You just keep, I said, see, Doc, I don't like the gagging, Doc. You don't understand. I have to have gas when I go to...
All right, let me take a look.
Okay, so the guys,
running away.
the guys in the booth are having a good time right now. See, Doc, when I go to the dentist, Kelly, this is what I do go to the dentist. I ask for gas. I don't care what he doing. I gets me a nice hit of gas. And get that gas in there to where your fingertips is tingling. I get it to where nothing matters, and then I'm nice, and then I let the doc go ahead and do his thing. I'm just over here clowning around. There's only one way to get over the fear. We gotta face this thing head on. So Dr. Cantor's gonna take a quick look. Now, Kelly, do you have problems just sitting in the dental chair?
No, it's usually like after I get my teeth cleaned and the actual dentist comes in because the dental assistant will clean my teeth and then he'll come in and look at everything. So that's when I usually get really nervous.
Okay, well, let's just take a seat there and watch your little dress and everything, because we don't know watching this show. There you go, that's how you do it.
How are you doing, okay?
Yeah.
Yes? Well, first of all, you had a traumatic experience as a child. Most people experience fears when they have a traumatic experience as a child. So there are certain things I would tell you to try and overcome your fears. The most important thing is express your fear. You don't want to keep it bottled up inside. Explain to the dentist why you're scared. In your type of situation, you had teeth pulled as a child. Your jaw was growing, and your teeth didn't have room for your teeth, so they had to take the teeth out. That's not going to happen anymore. You're 20 years old, the jaw is not growing. There's no reason for you to be scared of having teeth pulled out, because if you go to the dentist regularly, that's not going to happen.
Okay, so Dr. Cantor and Kelly are gonna head backstage to finish this exam. But what we're gonna be doing is we're gonna be checking in on them from time to time and see how it goes. So when we come back, we're gonna see how Dr. Cantor makes all the suggestions to make a patient comfortable. And for all of you in the audience who raised your hand, which was 70% of the room who has a fear of going to the dentist, Doc's gonna walk you through a process that'll help you out. Okay, we'll be right back. Let's check in with Kelly and Dr. Cantor right now. Remember little Kelly? How's it going in there, Doc?
It's going great. She's great. She's starting to feel more comfortable, warming up to me. We have distractions. We have the Steve Harvey show on. We have some music going. You know, the first visit, always want a consultation. Let the patient feel more comfortable, get more acclimated, get a relationship going, just to make her feel more warmer and make her feel at home.
Hey, can I suggest something to you, Kelly?
Sure.
Close your eyes when he's doing that. Because, I mean, it's really rough looking at his hand, all that movement in your mouth. I close my eyes, get some music, and get plenty gas. I'm sorry. We'll be right back, folks. When we come back, we're going to see how Dr. Cantor makes all the suggestions to make a patient comfortable. So we'll be right back with that. Well, we're back, folks. You saw this early in the show. I put Kelly in the good hands of my friend now, Dr. Brian Cantor, to overcome her fear of the dentist. Now, Kelly, how you feeling?
I'm feeling a lot better.
Really?
Yeah, Dr. Cantor helped me feel more calm. He was really warm to me, you know, making sure I was in good hands, so.
Okay, so Doc, what did you do to make her feel comfortable?
Well, she did come a long way. I thought she was going to run off the stage when she first saw the dental chair, but
yeah.
For anxious patients, the first visit's always just a consultation. No work. Let the patient feel more comfortable with you. So in the chair, I wanted her to express her feelings, express exactly what happened as a child, why she was so traumatized, and talking and speaking out loud made her feel a little more comfortable. I gave her a stress ball that she's obviously squeezing right now, made her feel more comfortable. Usually for first visits on consultations, I always want you to come with a loved one or significant other. In Kelly's situation, I wouldn't want her to come with her mother because it would bring back bad feelings from her childhood experience.
Wow. Okay, Doc, so what should people who have this anxiety from going to the dentist, what should they know? Because, I mean, when I asked the audience who in here was afraid to go to the dentist or was uncomfortable at the dentist, like 75% of the people raised their hand.
Well, actually, 5% of the population is so phobic they will never go to the dentist. 20% of the population is phobic about the dentist. They'll only go in extreme emergencies, which is the worst thing you could possibly do. You want to see the dentist twice a year, cleanings, checkups, exam, x-rays. It'll limit your chance of needing a dental emergency and thus increasing your anxiety. So you really want to see the dentist twice a year.
I think it has a lot to do with the doctor you choose, too, because I really think that has to be a relationship.
You need to have a warm relationship. You have to have a warm, inviting office. The doctor has to have a calming effect on the patient. Kelly's actually not as bad as most of my patients. There are some patients, last week I had someone come in, she said she was going to the bathroom, 10 minutes later, half hour later, knocking on the door. She went to the restaurant next door, had drinks, came up, and that's how she dealt with her anxiety. Everyone deals with anxiety differently.
Look at that audience. Yes! Well, listen, I want to say thanks to Kelly and thanks to you, Dr. Cantor. Thanks for sharing that information. And thanks for being brave, Kelly. Very good, darling. We'll be right back, folks.